Women, we are not the best about getting help for our bodies when we need them. In fact, we usually wait until multiple systems are involved to go to the doctor and start asking for help. Today, we are going to discuss the common symptoms that bring women into my clinic with pelvic floor dysfunction. I'm going to list them in order of most common to least common, so stick around to the end because I'm pretty sure that the last one's going to surprise you. All right, the first thing that will usually bring people running into my clinic is when they have pain inserting a tampon or pain with intimacy. Now, many times women will tell me that they've had pain with inserting a tampon for years. However, they just stopped wearing tampons and used another form in order to avoid that pain. But it's when it becomes pain with intimacy that they're coming in my door because they want help for this issue, which is completely understandable. However, if you've been having pain with inserting a tampon for years, it's going to take longer to deal with. And chances are good that more systems have gotten involved. So it's really important to make sure that you get a complete evaluation of not just your pelvic floor, but your hips, your SI joint, and your low back to see how your body has compensated for this pain over time. Which leads to the second most common thing that brings women into my clinic is any form of sexual dysfunction. And that can be pain with insertion, but can also be difficulty achieving an orgasm. Many women don't know that that can happen over time as we age because of a pelvic floor problem. So they've struggled with the common symptoms of pelvic floor dysfunction for years, but it never got to the point of actually impeding what they wanted to do in life or the enjoyment they wanted to have in life, so they didn't necessarily get treatment for it early on. But now it's gotten to the point that it's impeding intimacy and making that difficult or challenging or frustrating, making them not want to be intimate with their partners, which can significantly affect your relationship. The third most common cause of pelvic floor dysfunction that brings women into my clinic is a feeling of heaviness in the pelvis. Now, if you've ever been pregnant, you're kind of used to that feeling of heaviness. As you get bigger and the baby starts to descend, you just feel like I'm literally carrying that baby around in my pelvis. So yes, it's normal when you're pregnant. However, it's not normal when you're not pregnant. So if you feel like there's this heaviness in your pelvis, it's probably because your pelvic floor muscles have gotten really tight and very sensitive, and you're getting some organ disruption, which is causing that sensation of heaviness in your pelvis. For you, it's important to make sure that you're working with a pelvic floor specialist who can also work with your organs and do some organ massage to make sure that everything gets back in the right place. The fourth most common sign that brings women into my clinic is actually urinary incontinence. So this typically starts as difficulty urinating when you laugh, cough, or sneeze, and it may have gotten to the point where it's difficult to make it to the bathroom. Now, this is the fourth most common sign because women definitely tend to put this off. It starts with the laughing, coughing, sneezing, and then they think, it's not that big of a deal. Everybody has it. It's normal because so many people do have it. And I do understand that many people do think it's normal because so many women have it. But just because so many women have a dysfunction, that does not mean it's normal. It means our medical system is not adequately addressing this and helping women find solutions early on before it affects multiple systems. Okay. I'll get off my soapbox now. But it's the fourth most common thing that brings women into my clinic. So that means that a lot of women do consider it normal, but I'm here to tell you it is not normal. And the sooner you get help for it when it first becomes a problem, the easier it is to heal. As a women's health specialist, it is really frustrating to me to see women come into my clinic in their 40s, 50s, and 60s and require an extensive amount of treatment that if they had gotten it in their 30s would have been very easy to fix up. And it's lovely to see more women coming in who are in their 30s, who have had children, who have been referred to by their OBGYN because the OBGYN says it's not normal to pee when you laugh, cough, or sneeze, or run, or jump, or anything like that. So I'm super excited to see that this tide is turning. However, there's this older generation of women who did not have that information when they were young. And now there's multiple systems involved, and it's taking taking longer to heal, and they're really frustrated that they didn't get help earlier. So if that sounds like you, I want to encourage you, there is still hope for you. We can still fix your pelvic floor dysfunction. It will take longer than it did when it first started, but I promise you there are still things that can be done to help you too. And the fifth most common sign goes along with that, and that is fecal incontinence. Now, women definitely don't want to talk about this. Nobody wants to talk about this, but it is a problem when you can't hold things in or when things come out when you're farting. This is not normal if it happens regularly. Now, I understand you may have eaten something a little bit different and things happen a little bit. You know, food affects your digestive system, and I understand that. It happens once or twice because you ate something that maybe you know you shouldn't have. I'm not super concerned about that if you can state the symptom that caused it, and usually it's a food trigger that will cause that. However, if it is happening regularly and it doesn't seem to matter what you're eating, then this is definitely a pelvic floor dysfunction, and you want to get it taken care of as quickly as possible, because this is definitely a difficult one to be struggling with. On the opposite side of that spectrum is reason number 6 that brings women into my clinic, and that is constipation. Now, I will say that many women who come into my clinic do not come in for constipation. They are actually struggling with one of the other issues, and it's only when we start talking about their pelvic floor dysfunction and their symptoms that they've had over the years that we start to discuss constipation. And they're like, oh, I've tried everything for that. I've changed my diet, I've drank more water, I've taken fiber, I've taken over-the-counter medication. They've done all of these things to deal with their constipation and it hasn't resolved. Well, friends, if you've done everything else and it hasn't resolved, chances are good that it's due to pelvic floor dysfunction. So if you happen to be one of those people who is suffering with constipation and you have already done everything else and you're at your wit's end of what to do about it, I'm going to encourage you to seek help from a pelvic floor specialist who can look at your entire body along with your pelvic floor and make sure that you're getting the treatment that's designed for you. Alrighty, ladies, there it is, my top 6 reasons that people come into my clinic with pelvic floor dysfunction. Which one did you find the most surprising? Drop a comment below and let us know. If you like this video, give it a thumbs up. And if you'd like to learn more about pelvic floor dysfunction, I'm going to recommend you download my free webinar where we discuss all of this and way more. If you've been suffering with hip pain that hasn't gotten better, you've already been to the doctor, you've taken some rest time, you've taken some medication, and you've done some massage therapy, you may have done some physical therapy, you may have even gone to the chiropractor, and this problem is not resolving, I'm here to tell you today that this problem might be due to an issue in your pelvic floor. Now hold on, before you leave, let me explain. I'm Dr. Amy with Physical Therapy for Everybody, and I have seen so many women coming in recently who have hip pain that they have been everywhere, they have tried everything, they have rested, they have worked hard, they have done all the different things, and they're not getting the results that they're looking for. The amazing thing is that I recently had a patient come in who has chronic hip pain that she's been dealing with for the past 15 years since giving birth. And she was getting a massage from her massage therapist who said, actually, I think this hip pain may be coming from your pelvic floor. I was amazed and so excited to hear that a massage therapist was able to realize that this hip pain is not resolving and it could be due to a pelvic floor issue. Let me explain how that works. The pelvic floor muscles attach into the deep hip internal and external rotators, which means those muscles that are really, really deep in the hip, we can't actually put our finger on them because they're so deep in there, but they're right around that femoral neck, which means every time we move our hip either in or out, we're activating the pelvic floor. So if your pelvic floor is tight, it's going to be keeping that hip from being able to move in or out, depending on which part of the pelvic floor is tight. So a lot of women don't understand this connection between the pelvic floor and the hip internal and external rotators, and don't understand that their hip problem may actually be a sign of a pelvic floor dysfunction.
And if that sounds like you, we're going to discuss today the top 3 stretches that I recommend people do who have been suffering with hip pain that has been unresolved, even though they've tried other forms of treatment. So if that sounds like you, let's get started. All right. The first stretch we're going to do is a psoas stretch, and that's for the hip flexor. The reason why this is so important is because the hip flexor attaches not only onto the hip, but it attaches onto the lumbar spine. So the lower 5 vertebrae all have arms that stick out to the side. They're called the transverse processes. And the psoas actually attaches onto the front of those. So if you're having low back pain and hip pain and pelvic floor dysfunction, probably your psoas is involved. Now, a lot of people try really aggressive stretches for these, and sometimes that's what your body needs, and I understand that. Today, we're going to start with a really gentle stretch because we want to make sure that your low back's safe. We want to make sure that you maintain pelvic alignment so that you can get a good stretch through that psoas. So I like this psoas stretch because you're in a neutral position with your pelvis. Your low back is stabilized, so you're not going to have too much torquing going on. What you're going to do is you're going to lay off the edge of your couch or your bed or somewhere that you can put your foot on the ground. Now, if you don't have anywhere in your house like that, what you can do is build the ground up to your foot by using things like pillows or books or a stool or something like that. You do want to make sure that your foot is stable because that's going to allow this psoas to stretch. Now, in this position, because this is a lower table and I have really long legs, this is actually not enough of a stretch for me. So if that's your situation, you're just going to sneak that toe back, but you're going to keep the toe on the ground and let that knee drop down further. Now, in this case, I'm getting a nice stretch through that psoas. But if I wanted to increase it a little bit more, I could use my hands to bring this knee to my chest, and then that's going to get a really nice stretch, not just through my psoas, but through my quads. You want to hold this for 10 seconds and then release. Give yourself a 10-second break. You could switch over and do the other side if you wanted to, and then come back. And I recommend doing this 3 times. All right, the next stretch is called a figure 4 stretch, and you've probably seen this for a hip stretch, and I definitely love it because it gets those external rotators on the outside of the hip. What you're going to do for this one is put your ankle on the other knee and then push your knee away from you. This may be enough of a stretch for you, and for some people, even getting their ankle up to their knee may be enough of a stretch on its own. You may not need the hand. So you can start here, or you can use the hand to push down. Now, if you find that this position is still not enough of a stretch for you, you can again bring that knee to your chest to get a stretch through the outside of your hip. Now, the goal is outside of the hip here. Now, I will warn you that some people, when they get into this position, get a pain in the inside. Now, we're going to deal with that one in just a second. However, if that's you, you need to stay here because we don't want to be pinching the inside of the hip while we're trying to stretch the outside. That's not going to lead to any good conclusion right there. And again, you're going to do this with a 10-second hold 3 times, and I recommend doing both sides. And our last stretch that we're going to cover today is for that pinchiness that you get inside the hip. Now, for some people, that's the psoas that will get pinchy when you're trying to bring your hip up towards your body. But for some people, that's the adductor. So the adductor is the muscles on the inside of the leg, and they can get really, really tight really, really quickly, especially for women because our hips are wider than our knees. So for an adductor stretch, what I like to do is the butterfly stretch laying on your back. So you're going to put your feet together and let your knees fall out to the side as far as you feel comfortable with. Now, for some people, this is really, really tight, and they actually need to use pillows underneath their knees to give them some support so they're not in so much pain. So that you may need some pillow support to help keep your knees up a little bit higher. And that's fine, whatever feels like a comfortable stretch for you. Now, some people will do the butterfly stretch sitting up, and they feel like they get a better stretch that way. That's fine as long as you're getting a good stretch. Now, for people like me, my ilium and my sacrum don't tilt very well. And so when I'm sitting up, it's hard for me to actually get a good adductor stretch because I can't get my sacrum sitting in the right position. So for me, I need to do it laying on my back, and that's where I get the best stretch through my adductors. I don't have a problem doing it sitting up, and it could be a better stretch for you if you're more flexible in your ilium and your sacrum diagram, but just keep that in mind. If you've always struggled with a seated butterfly stretch, that may be why. So if you've been suffering with hip pain that's been unresolved, even though you've been everywhere and you've tried everything, I'm going to recommend that you try these 3 stretches on a regular basis. Now, regular basis is the key to getting the benefits that you want. You should be doing these stretches a minimum of twice a day, and I recommend trying them for an entire month. You should start to see some benefits after just a couple days, but to fully get those hip muscles to release and to stay relaxed in the long term, you need to do these stretches on a very regular basis. Now, once you feel like your hip pain has resolved and your pelvic floor is moving better, you can do these stretches once a day, but I do recommend that you continue with these exercises on a daily basis to maintain your results for the long term. All right, over to you. What did you think of the stretches? How have they worked for you? Have they decreased your hip pain? And what questions do you have? Did watching this video bring up any other questions for you? Definitely drop a comment below. We love to make videos to answer your questions.
Ladies, how do you know if you need pelvic floor PT? There are a lot of common signs that get thrown around that people tend to be generally more familiar about nowadays, which is fantastic. However, there's a lot of signs and symptoms that people don't know about or aren't discussed as frequently. You may have been at a party where y'all are having a good time, a couple of beverages, and someone jumps up and says, "Oh, I gotta go to the bathroom before I pee my pants." And that's a pretty common sign and a pretty common story. However, I had one patient one time who had that happen and then was like, "Hey, what about pain with intimacy?" And all of her friends looked at her and like, oh no, we don't talk about that. So today we're going to talk about all of that stuff. And we're going to talk about how all of those things are connected through your pelvic floor. Because I've had many patients coming in recently with all of these air quotes around the word random symptoms that are actually all connected through your pelvic floor, but nobody's ever explained that to them. So that's what we're going to talk about today. We're going to cover the 8 most common signs of pelvic floor dysfunction. And I guarantee you that there will probably be 1 or 2 in here that do surprise you. So definitely make sure you listen to all 8 signs to see if this sounds like you. And if you find yourself in any of these signs or stories, I definitely recommend you finding a specialist physical therapist who can help you deal with your pelvic floor symptoms now. The reason why is because they don't tend to get better over time. They tend to get worse. So right now you may only have 1 symptom and it may not interfere that much with your day-to-day life. But what I found in my experience is that over time, more symptoms start to present themselves. It becomes a bigger problem and it also takes longer to heal. So the sooner you start working at the specialist, the sooner you can get on your healing journey and not have these problems compound so that by the end of it, you're dealing with all 8. All right. We're going to start with the most common sign that luckily people do talk about nowadays, and that is peeing when you laugh, cough, or sneeze. Now, a lot of people do struggle with this problem, and they consider it to be normal that when they laugh, cough, or sneeze, they do urinate a little bit. And for some people, it is actually a lot. I've actually worked with patients who were so concerned about this problem that they would have to wear a pad whenever they were leaving the house because they just never knew when it was going to happen. Now, this problem affects many, many women, and they tend to feel that it's normal because so many other people struggle with it too. Or maybe the doctor has even told you that it's normal to have this happen after you have children or as you age, that it's a sign of menopause and the changes in your pelvic floor. I will tell you that yes, your pelvic floor does change with menopause. It's definitely seen and scientifically researched. However, that does not mean that you should be peeing yourself when you're laughing, coughing, or sneezing, or that you should have to give up your favorite activities, including running, because you're suffering with pelvic floor dysfunction. So I struggle with this term because people say, oh, well, it's normal in that it affects so many people, which is true. But just because it has the ability to affect half of the population doesn't mean we should consider it normal. Now, I will say that nowadays women's health and pelvic floor health has become more something that we're discussing, and doctors are starting to realize how important it is to get early treatment. So I'm super excited to see this change over time, and the younger population, the younger women who are having children now, to be reaching out for help early on. I think this is a very positive change. However, I also know that people who are a little bit more mature, like myself, did not get this advice when we were young, and we're just kind of brushed off now at this point. Now, I'll tell you, if you have these symptoms right now and you are in your 50s or 60s, you do want to get them taken care of still, because what can happen is you can lead to further problems, including needing a total hip replacement, which is actually due to a pelvic floor weakness. Now, you may think, total hip replacement, everybody gets those too. Friends, just because everybody's doing it doesn't mean it's normal. Remember what your mama said when you were growing up. If everybody else is going to jump off the bridge, are you going to jump off the bridge too? No. Let's fix the pelvic floor now and not have to have that total hip replacement. Now, symptom number 2 is actually on the opposite end of that spectrum, and that is not being able to fully empty your bladder or not being able to start going when you sit down on the toilet. Now, a lot of people don't understand that this too can be a pelvic floor dysfunction, but basically in this case, what's happening is that the pelvic floor is so tight that it cannot relax enough to let the urine pass completely. And this gets to be a big problem over time, which can even lead you to the emergency room because you have to get catheterized in order to be able to urinate. That's not what we want. We don't want to have to go to the emergency room for that. Doesn't matter how old you are. You don't want to have to go to the emergency room for that. So this is something that needs to be addressed quickly. Now, if you're suffering with this right in this moment, what I would recommend is trying to do some deep breathing when you sit down on the toilet. Doing some deep breathing activates the diaphragm, which decreases the tone in the pelvic floor. It may help you to be able to get everything out completely. However, if this continues for a prolonged period of time, more than once or twice, I would say, you definitely want to get help from a specialist and figure out why is it that your pelvic floor is so tight? Because your pelvic floor is just responding to the pressure that's being put on it. So there's probably dysfunction somewhere else. Now, one of the symptoms that's less commonly known is pain in the SI joint area or the low back. So the SI joint is made up of the sacrum, which is the heart-shaped bone that's at the base of your spine, and the ilium, which are your hip bones, so one on each side. Sacroiliac joint, SI joint. Now, a lot of people who are suffering with SI joint pain actually do have pelvic floor dysfunction because the pelvic floor attaches right near the SI joint as well. It's all connected. And if you have any ilium mobility issues or any sacral torsion, this can put increased pressure on the pelvic floor because the muscles are not in the proper alignment. This can definitely throw off your pelvic floor and cause a whole bunch of other symptoms that people don't really realize are actually all related to a pelvic malalignment issue. Because again, friends, it's all connected. So if you're suffering with very deep low back pain or SI joint pain, definitely recommend making sure that you're working with a specialist who can not only treat SI joint pain and low back pain, but who can also work on the pelvic floor, because chances are that you're probably suffering with problems in both areas, and they both need to be addressed to relieve your pain symptoms. Now, I would say the most common symptom that brings people into my clinic is that they have pain to palpation or tenderness when they're inserting a tampon, or pain with intimacy. This tends to be the symptom that sends the red flags off, the sirens blaring, saying, uh-oh, I gotta deal with this. Now, I've got to tell you, if you are to this point, chances are that you have actually had a pelvic floor dysfunction for a period of time. And as you listen to these symptoms, you may be like, oh yeah, that's been going on for years. That's been going on for years. But you just started having that pain with either inserting a tampon or with intimacy. Well, I'm here to tell you that those red flags are going off for a reason, because that means that your pelvic floor dysfunction has progressed to the pain point, and it is definitely time to get help. It does not get better from here. Once you get to this point, it's like it's tipped over, you're on the other side of the mountain, and you're headed downhill fast. So you want to seek help from a specialist now to start addressing this problem. And they'll talk to you about the other symptoms that you may have been having for years even that progressed to the symptoms you're having right now. Now, many women are surprised to find out about the next symptom of pelvic floor dysfunction, which is hemorrhoids. So many women think that hemorrhoids are not necessarily related to the pelvic floor, but it definitely tells us that there's something going on with the pelvic floor. The challenge is that people get hemorrhoids and they try maybe over-the-counter treatments, or maybe they do something with their doctor. However, they don't actually treat the thing that's causing the problem in the first place, and that is a pelvic floor dysfunction. So you want to make sure if you've started having hemorrhoids, or maybe you're just hearing this and been like, I've had hemorrhoids for years, but I'm starting to have some of these other symptoms, you want to seek help from a specialist. And if the symptoms before didn't get you to go see a pelvic floor specialist, I'll tell you that the thing that will bring people into my office is a prolapse. So what happens with this is that the pelvic floor actually starts bulging out because something is prolapsing into it. And it can be the vagina, it can be the uterus, it can be different organs. What happens is that women are washing themselves, they feel this bulge, they go to the doctor, and the doctor says, oh, you have a prolapse. And most commonly, the doctor will say you need to have surgery to tether that organ back up where it came from. Friends, you have a pelvic floor dysfunction, and now it's an organ mobility problem. So you need to find someone who can help you with both of these issues, because the organ is probably just stuck in the wrong position and can be helped out of that position, as well as your pelvic floor getting strengthened so that you don't have that bulging. However, you can't just start by strengthening the pelvic floor, because chances are that part of your pelvic floor is too tight. So if you try to do exercises just to strengthen your pelvic floor, then chances are good that you're actually going to make the prolapse worse, because it's going to increase the tension in the area of the prolapse. So it's important to make sure that you release tension before you do any strengthening, so that you get normal strengthening throughout the entire muscle. The least known sign of pelvic floor dysfunction, in my opinion, is constipation. Many women who come in to see me for one of the other reasons, when I start talking to them about constipation, they're like, oh, but that has nothing to do with this. Well, friends, chances are good that it's all connected, because most of them have tried changing their diet. Most of them have tried increasing their fiber. Most of them have tried over-the-counter medication. And although all of those things may help to decrease their symptoms of constipation, it doesn't actually solve the problem. Chances are that your pelvic floor is too tight and it has difficulty being able to relax enough in order to let everything out. And what happens then is it all gets backed up and it gets dry and it gets harder to push it out, which can then lead to hemorrhoids, which we already talked about. All of this stuff is connected, and it all points to your pelvic floor dysfunction. So definitely make sure, if you've suffered with constipation for a long period of time, that you talk to your pelvic floor specialist about that as well, to make sure that all of those symptoms are treated together. And the last sign of pelvic floor dysfunction may be the one that most people don't actually realize, but it's the inability to do a Kegel exercise. So if you feel like, I cannot do a Kegel exercise, I've tried, you may have even been to a pelvic floor specialist before and they did biofeedback with you and you were like, I just can't figure out how to do a Kegel exercise. Well, chances are good that it's actually because your pelvic floor is too tight. And what you need to do is have somebody help you to relax your pelvic floor so that you can actually do exercises. I'm still not going to recommend Kegel exercises. Just let's do some exercises that are actually healthy for your pelvic floor as opposed to Kegel exercises. All right, ladies, there it is, the 8 most common signs of pelvic floor dysfunction. Drop a comment below and let us know which one was the most surprising. Today, I've got the ultimate exercise program to fix your pelvic floor dysfunction and strengthen your core for good. Pelvic floor dysfunction can affect many women, especially after childbirth or with aging. So today we're going to discuss what you need to be doing now to make sure you don't struggle with problems like incontinence or hip pain, which may potentially lead to a hip replacement later on in life. It is incredibly important to make sure that your core, including your pelvic floor, are functional and strong to help you maintain your ability to do what you want to do as you age. Now, you may be saying to yourself, oh yeah, I do a lot of abdominal exercises, so my core is nice and strong. However, are you doing anything to help your pelvic floor? You see, the abdominals work with the pelvic floor and the muscles in the lumbar spine in order to create that core triangle. And if you're only working on the front of that triangle and not working on the back or the base, something is going to end up becoming dysfunctional in the future. All three of them rely on each other to work correctly to actually perform your core exercises. So we want to make sure that we're working on all of them all the time. Now, you may have come to this video because you are already suffering with some pelvic floor dysfunction and you're looking for some exercises to do. But you may have been lucky to find this video because you're wanting to start some core exercises, and this is going to be a great video for you as well. You ready? Let's get to it. All right, so the first thing we're going to do is deep breathing with the abdominal contraction. So when you're doing that deep belly breathing, you want to be breathing in through your nose, making a big belly bubble. Then you want to be breathing out through your mouth like you're blowing out a birthday candle. And at the end, you want to do that abdominal squeeze, so getting that really good abdominal contraction. Now, when I do that squeezing, make sure you notice I'm not going to be doing a bunch of tilting while I'm doing that, because I'm just trying to squeeze those abdominals, but not really trying to move the pelvis. Some exercises we will do in the future will be more focused on moving that pelvis, but we want to make sure right now that we're keeping it nice and stable. So here's what that looks like. You're going to take a deep breath in through your nose, belly gets bigger, and then out through your mouth. And then there's that squeeze at the end with no movement through my pelvis. In through your nose, out through your mouth, and squeeze. You want to do that for about 10 to 15 reps to make sure that you get good control with that. Now, if you have a hard time doing it and you're getting frustrated, just step away for a little bit and come back to it another time. It can be hard to get everything else to relax because usually we use the muscles in our upper neck for that breathing, and it can be hard to get them to calm down. All right, the next thing we want to do is get those glutes really well engaged. So we're going to start by doing some glute squeezes. Now, I like to do these laying down to start with to make sure I'm really getting a good glute squeeze and I'm not using my hamstrings or something else while I'm doing it. But you can also do this in sitting and standing, as long as you're getting a good squeeze of your glutes together and you're able to hold it for 5 to 10 seconds and you're not getting all the other muscles as activated. It's really focusing on those glutes. Now, to say that you can squeeze one muscle and not get the others activated at all is basically impossible because they all work together, but we really want to emphasize that glute squeeze with this exercise. So what that looks like is you're going to squeeze your cheeks together as hard as you can. You're going to hold for 5 seconds and then you're going to relax. And you can see, even with that, I get a little shaky after 5 seconds. Now, when I do it the next time, I want you to notice I'm not squeezing and causing this huge pelvic tilt, right? When I'm squeezing, the cheeks are coming together. There is a little bit of a tilt. That's just the natural motion that happens when those glutes get activated, but I'm not trying to lift up. This is not a bridge activity. That tends to get the hamstrings more involved when you do that. Not a bad exercise, just not what we're trying to do right now. Right now, what we want to do is really just squeeze those glutes together, hold for 5 to 10 seconds, and then relax. This helps to get those glutes to become a little bit more dominant than those hamstrings, because we tend to be very hamstring dominant, especially if we have pelvic floor dysfunction. All right, the next exercise we're going to do is actually a stretch, and it's for the psoas muscle. So your psoas is your hip flexor. Hip flexor is bringing your knee closer to your chest. But when you're stretching the psoas, it's really important to make sure that your pelvis stays in a neutral position.
Now, I know that there are a lot of stretches out there that are way more aggressive for your psoas, and those may be appropriate as you progress along. However, we want to start with something that's going to be really gentle. So I'm going to have you lay either on your couch or on your bed. I've had some people like to use their living room table. Whatever works for you is fine. And you want to make sure that your foot is resting on the floor. It's really important that your foot is not hanging off of your bed, because that will actually cause the psoas muscle to contract instead of relax. So if you're doing it on your bed and maybe your bed's a little bit higher, you can use pillows or books or a stool to build the floor up to your foot. It doesn't have to be anything that you could actually stand on, so pillows would be fine. It's just something that your foot can connect with so that you don't have that contraction of the psoas. What you want to do is make sure that your psoas is in a good stretched position. Now this one's not feeling super stretchy for me. This table is actually probably a little bit lower than what I would actually do it on. That's all right, because what you can do is you can sneak that toe back, which allows that knee to drop down now further for me. And now I can feel that nice stretch through my psoas. So that's right up here. It's right in the front of the hip bone is where you want to be feeling it. Now, because I'm bending my knee more, I'm also getting some of it in my quad, which is great. Quads can definitely use a stretch too. If you feel like you still can't quite get it, the next step would be to bring this knee up to your chest and hold it in place with your hands. Now, when you do that, you're definitely going to feel more of a stretch in the front of the hip right there. And that can be really helpful when you're trying to stretch that psoas. Now, this stretch I like to hold for about 10 seconds, and then I would scoot over to the other side and do the other side. Now, realizing from side to side could be different. So maybe if you're on one side, you just need to have your foot on the ground, but maybe if you're on the other side, you need to walk that foot back, or maybe you even need to bring that knee to your chest. You find the appropriate level of stretch for you and hold it for 10 seconds. All right, so now we are actually going to tilt that pelvis. So the goal of this exercise is to get that pelvis moving. Now, of course, it needs to be pain-free. So you do as much motion as you can pain-free. You may be able to increase the motion over time. What you're going to do for this is you're going to contract the abdominals to tilt that pelvis up, and then you're going to gently relax the abdominals so that your pelvis tilts in the opposite direction. So when you contract, it tilts one way, and when you relax, it tilts the other way. And you might feel your sacrum, that heart-shaped bone in the center, you're kind of rocking back and forth over it. And that may feel a little strange, especially if you're on a firmer table. It shouldn't be painful, but you may be like, hey, all of a sudden I'm feeling something that I haven't noticed before. It's okay, as long as it's pain-free. So with this one, you want to do about 15 to 20 tilts. Now again, if that much motion is painful for you or causes any low back issue, just make it a smaller tilt. Do more of that abdominal contraction and relaxing. You'll get a smaller motion through your pelvis, but you can work up to that bigger motion as you feel able to. All right, we have gotten to my favorite exercise, and the exercise that I recommend all women do all day long, and definitely do them instead of Kegel exercises, and that is our deep hip internal and external rotation. To do this, you want to be laying on your back with your knees bent up, your feet hip-width apart, and your knees approximately hip-width apart as well. We're going to keep those knees hip-width apart as we slide those toes towards each other, and then back straight forward. And we're going to keep going in this kind of windshield wiper motion. Now I have kind of long feet, so I'm actually going to move my feet a little bit further out just so I can get all the way through that range of motion. But make sure you notice that my toes are sliding. My toes are not lifting up. Lifting up will cause this to become more of a calf exercise as opposed to getting up to those deep hip internal and external rotators. After you've done 15 of those, you're going to slide your knees and your feet together. This time you're going to keep your heels together and you're going to slide your toes apart. Now you'll probably notice that I have way less motion in this direction, as most women do. I've actually only had one patient ever who had more motion in this direction. But that's all right, that's totally normal, and that's your anatomy, and that's fine. You're gonna go as far as you can, comfortably. You don't wanna be trying to strain and causing all this other stuff to happen, right? That's not the goal. We're just trying to get that as much external rotation as your body naturally allows. And again, you're going to do 15 of those. You're going to do 2 sets of 15 once a day if you're not having pelvic floor dysfunction, and twice a day if you are having pelvic floor dysfunction.
All right, there it is, your top 5 exercises to improve your pelvic floor health as well as decrease pelvic floor pain and start building core strength. Now, it's important to remember that you need to be doing these exercises every single day. It will take a while to build this strength, and you want to keep doing them until you get to the point that you're like, hey, these are really easy and I don't feel like they're challenging anymore. Once you get to that point, it's time to progress your core exercises and improve your pelvic health even further, but it's important to remember to do it every single day in order to get the outcomes you're looking for.